Hello everyone, my name is Mary Samuel. I work in the National Health and Social Care Professions Office as Development Manager. You're all very welcome to this fifth session of the series titled HSCP Leadership in Practice During COVID-19. This far, we have focused on various topics such as e-health, changes in work practice, responding to crisis, and service user empowerment. We have few HSCP leaders with us today. I'm delighted to introduce Ms. Jackie Reid, the National Lead of National HSCP Office, Ms. Fiona Keoghan, Director of Lean Transformation, St. James's Hospital, and Ms. Laura Loftus, Practice Education Coordinator for Speech and Language Therapy Services in NUI Galway. Thank you, Jackie, Fiona, Laura, for being with us today. So if I may turn to you first, Jackie, congratulations on the successful launch of the strategy, HSCP Deliver. What was it like for you to develop a strategy during the pandemic?
Thank you, Mary. I suppose the first thing that comes to mind is when the pandemic hit, there was a huge tension between the fact that we had done so much of the insight generation and co-creation work involving our service users and health and social care professions, representative bodies and leaders. And then the pandemic hit, and then there was that sense of, normal service had to stop and we had to pivot to doing things to do with the pandemic. And obviously some of the team was redeployed as well. So there was a tension between being very conscious of all the huge contributions and the work that had gone in and the collaboration from people to develop all the groundwork, and then not feeling like the right time to kind of press on with finishing it initially. So the fortunate thing was we had done all of the reading and analysis and coding of the data that we had collected, and so had the overall framework. So we knew what the impacts were that were going to be achieved if we could realise the potential of all health and social care professions. We knew what the commitments were from all of this work that health and social care professions were prepared to make, and we also knew what the supports were that they were going to need to follow through on that work and be able to deliver that potential. So we had that framework. The thing is, it just wasn't visible to anybody else. So I suppose what ended up happening is we pivoted to different work and different priorities, certainly at the beginning of the COVID pandemic. That was there in the back of the mind and might have been kind of unseen, but certainly from my point of view, that was underpinning everything, and it was there all the time as a touch point and helping to kind of decide and direct what we were doing. And then the second thing that happened, which I suppose was sort of an unexpected, nearly, I wouldn't say silver lining, but a piece that happened was that we were able to sort of track what actually was going on during COVID and all the different things that health and social care professions were doing, and the innovation and the extraordinary changes in the telehealth, all the different things that they were doing, and actually then feed that in to the framework that we had, and that all then actually was represented in the final written document when it was possible, I suppose, to take the strategy off the back burner and actually kind of complete it and finish it. So I suppose we had to kind of rethink, and we had to rethink then the final proofing stages, because we had started the whole process off with a whole system event representing all of the stakeholders in a room, and the intention was to kind of go back and do a second one of those. So obviously with COVID, all of that had to be rethought, and we had to find different ways of touching in with the different stakeholders to prove things and going through the approval processes. And it did go through all of the approval and the joint council and the EMT of the HSE to final approval and sign off at the very highest level.
Thank you, Jackie. It must have been a Himalayan task for you to pull this strategy. And you launched it in April of this year. So can you share with us the implementation plan?
Thank you, Mary. Yes, we were finally able to launch it in April of this year, and even though it was done virtually, and the good thing about that is it enabled a very broad and a very extensive audience to actually join us on the day, and we were able to be joined by a service user, who had been at the journey with us from the very, very start, a couple of health and social care professionals, and we had the Chief Clinical Officer and Chief Operations Officer launch it. And on that day, we were able to share the overall, or I was able to share where we were going with implementation. So there's a number of strands to that. There's a national strand, a strand for the National Health and Social Care Professions Office, and a set of actions for us for which I am accountable. There's at a national level, there's actions called out for implementation, and we'll be putting in place a high-level national strategic oversight group, which will include service users again and key stakeholders. There's operational level actions called out, and there's the actual actions called out then for individual health and social care professions. So when we launched the strategic framework, some of the key areas that we're working on in the office were shared. So those include things like advanced practice and leadership and practice education, to name just a couple. And we had a lovely plan of a suite of supports that we intend to put in place to assist local ownership and implementation, which I think is really key and was also a cornerstone in the development of this plan. But I suppose the cyber attack intervened just after we had the launch. So a lot of the plans involved things like workshops involving service users that were going to happen virtually. So obviously they couldn't go ahead as planned. And then we were very, very conscious just of the environment for people, and the stress, the huge stress and the fatigue that was in the system following the cyber attack on top of COVID. So decided really we needed to pause that part of it until the autumn, and hopefully people had a chance for some kind of a breather. And then we've held a couple of open workshops with health and social care professions to sort of sense check where people are at now, where they're at with the strategic framework, and what would actually be helpful for them. So in terms of that local ownership piece, we're now coming forward with new plans based on the input of health and social care professions to bring forward, and obviously keeping going with the work that we have set out for ourselves. So that's where things are at the moment, and look forward to engaging with people further as we go along during the course of this plan.
Thank you, Jackie, for the overview. Now turning to Fiona, who's representing clinical services. What was it like for you, Fiona?
Thank you, Mary. When the pandemic started, I was working in the area of improvement, and it was a very challenging time because obviously all the focus shifted completely away from improvement to firefighting in the moment. And I found that very challenging, both for the people that I was working with and how they could do their work. And many of them were pulled away from that work into something very different. And then also personally, I found it very challenging because in the moment that they were being pulled away from this work, there was also going to be an overwhelming need for the work that we were setting out to do. So that was really, really challenging at the time.
So there would have been a lot of changes that would have happened, Fiona. So upon reflection, can you share with us a change area where you think you maximized on the opportunity that you got?
I think the biggest area of change for me that really stands out was how HSCP leaders came together to problem solve. This would have been about 6 or 7 months after the pandemic started, and it was with a team I had done work with in the past, but we were particularly interested in the area of integration and outreach into the community. And HSCPs in that system came together, and we managed to do a week-long virtual event, which I know would not have been possible pre-pandemic. And what really struck with me was how people embraced that change, how they used the technology to come together, and how we managed to work through our pathway or a problem very, very systematically. And it really struck me how what was very challenging became an opportunity, and it was definitely something we wouldn't have done before that. And I've also felt probably a lot of people had seen what was possible in the pandemic, and they'd also been working very differently with their colleagues because of the pandemic. So the understanding of each other's work, etc., had changed in that time. So that was kind of something very, very powerful at the time. But also, I guess that even though people were very tired and in many ways, worn out, we're also pushing forward and embracing something different. And that was, and I think they really enjoyed that experience. But it was also really, really, really good to see.
So if I may ask you this, Fiona, there would have been many situations where you wouldn't have had the answers and people would have looked up to you for answers. How did you manage such scenarios?
Obviously, during the pandemic, for all of us, there were many times when we didn't have the answers, and nobody had the answers probably, but also what I usually do in those circumstances would be to look internationally, to look outside and see, is there a different way of doing this? Are people doing this already? Are there a set of principles that describe what a good service in this area or what a good pathway would look like? Is there something we can look at? And then the way I would work would be to look at where we are with our own system. Where are the gaps? Can we categorize those? Can we look to see what can we do now with what we've got, with the people that we have, and how can we move that forward? And I suppose try to break it down into pieces of work that feel like they could be possible. I suppose I also really try to create the conditions where people feel that they can move forward and that it's safe to move forward. So I would try and align up the people who maybe they report to or who can make this happen in the system to try and say, this is the direction of travel anyway, and we need to go forward. That whole piece around in leadership of asking for forgiveness and not always asking for permission, because we can be very stuck because it hasn't been done before in Ireland, but it's happening elsewhere for a very long time perhaps. So getting into that space to get people to think this actually could be possible. I think also in the notion of never wasting a crisis or having a burning platform, we couldn't have a bigger one really when you look at the impact the pandemic has had on the population. So that was an opportunity in itself. I mentioned already the impact that it had of people embracing technology, and I think we were particularly good at that. So that was another opportunity. And then also we had the opportunity that was created by people having been working differently anyway.
Fiona, as a leader within clinical services, what is your vision for the future?
So my vision for the future, I suppose, for all of the healthcare pieces, that we work together, that we form a system, that we keep the patient at the center of that system, and if we do that, we will all progress. I think we have a big opportunity because of what's required now in terms of rehabilitation for our population and in terms of what we have to offer skills and competency wise. So I would love to see us pulling up our chair at that leadership table, offering our skills, offering to work differently, partnering with others in the system to move forward, and driving together, together with the academic institutions and with the service delivery people, moving forward together. I suppose that's where the change will happen at the patient level, and that's the opportunity that we bring, is that we really understand that need very well, and it's an opportunity for us all, I think.
Thank you, Fiona. So to deliver the clinical services that Fiona was mentioning, and to meet the current recruitment needs, we need to engage with our higher education institution partners. So we have Laura with us today, and she's going to share her experience. So Laura, if I may come to you, what can you share with us the challenges that you were presented with during the pandemic?
Thanks, Mary. Yes, absolutely. Pre-COVID, we would have experienced difficulties securing placements for students. So it was, I suppose, on top of that difficulty that COVID created more challenges for us. So obviously when COVID initially happened, all placements were ceased. And that led to kind of a backlog of placements that were needed. And then, of course, the redeployment happened of speech and language therapists. And that in turn, by the time they came back, meant that there were long waiting lists. So a lot of therapists weren't really, I suppose, in a position to be able to facilitate student learning. So it was really a perfect storm, kind of COVID. And we had, as I said, the difficulties beforehand and then what was created as a result of COVID.
So amidst all these challenges then, Laura, you had to maintain the standards and keep the profession going. So how did you turn these challenges into opportunities?
Well, besides panicking for a couple of weeks, obviously, initially we thought that, COVID was going to be a few weeks of an incident and we were all going to return to clinics. And obviously that became very, very clear after a couple of weeks that that wasn't going to happen. So what we did was we really sat down and we looked at what did we have control over in our, what was within our own remit. And really fantastic facilities at NUI Galway. We have a really excellent on-site clinic with observation rooms and clinic rooms. So we knew we had this facility and we needed to maximise it. And I have to say we had an excellent, really experienced practice ed team. And that really stood to us as well in the time of crisis. The other thing was that we had excellent networks and we really accessed those, not just the ones within Ireland, our colleagues across the other universities, but colleagues abroad and in particular in places like Australia. So I suppose this led to a multi-pronged approach to how we were going to manage placements in the crisis. And it led us to developing things called team placements. We introduced a lot of simulation into the program. We introduced remote supervision and telehealth.
So Laura, the telehealth work that the SLT students did, it did receive a lot of positive attention. Can you tell us more on that?
Yeah, absolutely. The telehealth probably, received probably the most attention of the initiatives that we introduced, and it certainly was one of our greatest success stories last year. I suppose it's really important to point out that as a practice ed team, we were incredibly nervous about introducing it, and it wasn't really something that was comfortably in our skill set. So we were very, very lucky. The students really taught us how to manage that transition, and I think it was a real excellent marriage between us and them. Where they taught us and we were able to teach them the clinical skills. So as I said, we had absolutely fabulous facilities in NUI Galway, and it was one of the things we were able to do. We could socially distance our students across all the rooms, and again, the clients didn't need to come in. We were also able to kind of access expertise in other parts of the country. So we had clinical educators who were very experienced in telehealth, and they actually supervised our students while they were in Galway and they were in another part of the country. I have to say the clients loved it as well. I mean, they were able to access a service that was completely safe from their own homes at a time when a lot of other things couldn't go ahead. So as I said, it certainly was something that we're very proud of as well.
So a lot of innovative solutions, Laura, a lot of win-win spaces as well for the students, for the service users, and for the service itself. So having explored all these innovative solutions, Laura, what are your top 3 leadership learning having gone through this journey?
So I suppose my first piece of advice would be don't be afraid to try new things. Certainly, we explored lots of new things, and I'm really glad we did, because it provided us with lots of new ways of doing things. The other thing I would say is it's really important to listen to your team. And I don't just mean the practice ed team, I meant our students as well. Because oftentimes when we had difficulties and we couldn't think of a solution to something, they were really good at coming up with another way or a novel way of doing things. So it was really important to get their voice as much as the whole team kind of input as well. And I think finally, my word of advice would be communicate the bad as well as the good. You know, not everything ran 100% smoothly. And I think it's really important for a leader to model failure as well. So those are my 3 words of wisdom.
Thank you so much, Laura, for that, and all the very best in all your future interviews with the students. Coming back to you, Jackie, now, looking back specifically at the past 18 months, so looking back to look into future, what are your key messages to HSCPs?
Thank you, Mary. Well, I suppose the key 3 things that I would be that are on my mind to say to health and social care professionals now are around looking at the big picture, the strategic view. They're around taking ownership and about partnership and collaboration. So in terms of the big picture, I think strategic awareness is just really important and can be very difficult, but I think it's really important to actually, we tend to be working with our head down, focused on what we're trying to do, but it's really important to pull the head up as well and look up, out and around and see what's actually going on. And the reasons that I think that's really important for health and social care professionals, or I would commend them to think about this, is that it's much easier to influence and be relevant if you understand what the bigger picture is and what's going on, what's out there politically, what the key priorities are. And I think that can help health and social care professions to achieve the things that they want to achieve for their service users and their services. So that's why I would say to look at the big picture and become more strategically aware. The second piece around taking ownership and owning your own power, I think sometimes people have more power than they realize that they have. And I think we really need to focus. It can be very seductive to kind of think about all the things that really, if only other people would do X, Y, and Z, it would make my life easier. And then I could do all these fabulous things. But I think most of the time there's things within our power and we need to step up, all of us, myself included, and take that power. And I suppose at risk of you know, not quite saying the right thing, but there's times when, you know, you just need to be prepared to ask for forgiveness rather than permission and get on with things. So that's my second message. And the last piece is really all about collaboration. And we've spoken about that from the start. My key goal at the start of developing the strategic framework was to actually have service users front and center. And I actually brought somebody in to hold me to account about that. That was their specific task, was to call me out if I wasn't doing that. So I think if we put service users front and center and we focus on collaboration, I think we won't go wrong. And when collaboration, I really mean in the very, very broadest sense. So I mean within and across our own services and disciplines, across disciplines, across services, and across, you know, traditional service boundaries. I think that's really important. And again, to go back to that lovely quote that one of our service users said at the very, very outset, is that really, you know, whatever you do it together. And I think we're stronger together in the most positive and productive sense of saying stronger together. So those are my messages, Mary.
Thank you, Jackie, Fiona and Laura, for sharing your experience with us. My sincere thanks to Tina and Miriam as well for helping us in planning and in recording this webinar series. HSCP leadership is a key priority for the National HSCP Office, and we produced this 5-session webinar series following a survey that we conducted in summer 2020. Our intention was to capture all the valuable leadership learning moments that we have gained over the pandemic and carry the learning into the future. Please look out for the communications from the office regarding leadership support. I would like to express my gratitude, my sincere thanks to all who were involved in the production of this webinar series. So with that, I would like to bring this webinar series to a close. Thank you.